Good afternoon, everyone. My name is Maya Angela Mays, and I am currently a behavioral health technician student who's aspiring to become a behavioral technician soon. So today, I wanted to post a video on a topic that I created. As some of you may know, I've posted various videos over the last few months in relation to behavioral health and mental health. Well, today I'm presenting my final project. I am at the end of my course, and I have a 10-slide PowerPoint that I'll be discussing. I have it here with me, and my topic for this final project PowerPoint is healing depression with expressive arts therapy. Now, to give you a little insight, although I am a behavioral health technician inspiring to become a behavioral health technician in the future, I'm currently a student aspiring to become a technician in the future. My main goal is to become an expressive art therapist. Behavioral health, for me, will pretty much place me on the track of becoming an art therapist in the near future. And so I believe that both go hand in hand, knowing and understanding the importance of behavioral health and the different behaviors that, all of us have. And just the mental health aspect of it, I believe, kind of all ties in to having a better understanding about expressive arts therapy. So I'll get started. So, as I said, this project is on healing depression with expressive arts therapy. So, let's discuss what depression is to help us have a better understanding on what it is. Depression is a mental health condition that affects emotions, thoughts, and behaviors. Symptoms may include sadness, hopelessness, fatigue, and loss of motivation. Depression can impact relationships, work, and daily function. There are different types of depression, such as seasonal affective disorder, prenatal depression, and postnatal depression. I personally, personal disclosure, I deal with depression quite often myself, and I don't know the variety of forms that I have experienced, but I know for sure that I have experienced the seasonal affective disorder. For me, the holidays, Christmas, Thanksgiving, family-oriented type of holidays have always brought on my depression and just, not feeling good, not feeling just sadness and things like that, that I felt with the seasonal affective disorder, depression. So I can most definitely relate to that one. So those are just a few forms of depression. Going to the next slide. What is expressive arts therapy? Now, I get this question a lot, like when I tell people I'm aspiring to become an expressive arts therapist. And, sometimes people might ask, well, what is that? Is it a real thing? Is it like a therapist? How much does it differ from a regular therapist? So let's talk about that. So, an expressive arts therapist combines psychology and the creative process to promote emotional growth and healing. This multi-arts or intermodal approach to psychotherapy and counseling uses our inborn desire to create, such as therapeutic tool can help initiate change. For some people who have a hard time articulating what they are feeling, self-expression through arts can be useful. Expressive arts therapy draws from a variety of art forms, and this integration of methods can help patients access their emotions. So that pretty much is a gist of what expressive arts therapy is. And for me, I thought that would be, something really good that I can pursue. Well, for one, I believe it is my purpose. I've gone through a lot, I've had many traumatic experiences, especially, in childhood. I've had a really dark, childhood, and so a lot of that trauma has caused me to have depression and anxiety. And so one day I was just trying to figure out how can I use my experiences to help other people, and I just believe that God led me to it. The idea just kind of, I don't know, it just, I don't feel that I can. I just believe that God brought the idea to me. And the interesting thing about it is that maybe about 15 years ago, I had met a lady through a friend at a barbecue, and we were just, she was an older woman. We were just holding conversation, and she was just asking me, like, what are my dreams and aspirations? And at the time, fashion was my thing. I've always been an artist. I've always wanted to pursue some form of art. So at this time, fashion, was my thing. I thought I wanted to, get my degree in fashion design, go to fashion school, graduate, work for a designer, move to New York, work in a boutique, work in a high-end boutique in New York. I thought I had it all planned out. But I remember this particular conversation with this lady I met. I'm telling her all these fancy plans I have to move to New York and pursue fashion. And I remember she told me, or she asked me, have I ever heard of art therapy? And I told her no. And she said, you should look into it. I really think it's something that you should do. And I remember I was a bit offended because fashion, like I said, was my thing. And I've kind of sort of always had people try to redirect me in what I want to do. And so I pretty much stand firm on what I want to do and what I don't want to do when it comes to my desires and passions. So when she mentioned art therapy, expressive arts therapy, it kind of just went in one ear and out the other. Fast forward about 5-6 years later, art therapy just popped in my mind one day, like literally out of nowhere. And I remember, like, okay, let me, do some research and see what art therapy is. And then once I read up on it, it was like, oh yeah, this is officially what I'm going to do. It was like automatically, everything else just went right out the window. And I just knew at that point in time, oh yeah, that I want to be an expressive arts therapist, period. And so that's a little background on that. And so here I am. All right, let's go to our next slide. How creativity supports healing. Because people often ask, well, how does art therapy enable healing in a sense of coping when it comes to depression and other mental health, disorders. So creative expression helps to release difficult emotions. Art and movement reduce stress and anxiety. Creativity promotes mindfulness and emotional awareness. individuals who can communicate their feelings without relying only on words. So individuals can communicate feelings without relying only on words when it comes to art therapy. So I often tell people my personal definition of art therapy is using art to creatively express how you feel. That's pretty much how I view it. Okay, let's discuss the benefits of expressive arts therapy. There could be a variety of benefits, for you. So let's get into it. Some of the benefits of expressive arts therapy are it improves self-esteem and confidence, encourages healthy coping skills, reduces feelings of isolation and loneliness, as well as supports emotional balance and resilience. And although I am still on my healing journey, I do believe this to be true as long as I am consistently receiving art therapy services, because I have, even as an aspiring art therapist, I have had art therapy sessions before, and honestly, I love it. Like, it's very relaxing, it's very therapeutic for me. I get to spend that time to just create, and I just love it. Like, I don't have all the right words to describe it, but I think I recommend everyone, to just give it a shot, go out and take an expressive arts therapy, session, if you can, see if you could seek or find some expressive arts therapy, near you, wherever you are. All right, so last but not least, let's talk about the role of an art therapist. What responsibilities does the therapist have? What is it that you can expect from them? So, the role of an art therapist is to create a safe and supportive environment, encourages creativity without judgment, helps individuals process emotions expressed through art, and supports goal setting and emotional healing, which is one of the most important parts of the process, because you as the client or the patient, you want to make sure that your therapist know exactly what it is that you need. What is it that you expect, your expectations of the therapy sessions? What is it, how can you benefit most from it, And when it comes to art therapy, I think for me that the best or the most fun part about it is that you can use whatever type of creative expression that you want. So it's not, it's not necessarily one type of medium that you have to stay in. And there's a variety of different, expressive arts therapy out there. You have dance and movement therapy, you have music therapy, you have art therapy, mindfulness practices. There's a variety of things that I believe everyone could possibly like and find the best form of creativity for them. So, with that said, this is pretty much the end of my presentation, and I hope that you out there in YouTube world have learned something. Maybe it may inspire you to pursue art therapy if you thought about it before. Maybe it'll inspire you to take an art therapy session. If you currently are in therapy or counseling, maybe it'll inspire you to, you know, kind of add a bit of fun and creativity to your, sessions that you may have already as far as your talk therapy. Maybe you can have, you can combine a bit of creativity with your talk therapy and kind of make it, a bit fun, because I do understand that it can be extremely hard when talking about the different traumas, because sometimes, or at least for myself, I'll speak for myself, I don't always feel good sitting in front of somebody and telling them all of this, bad stuff that I've experienced or negative things that I've been through. So sometimes you might just want to take a break from talking and just get the drawing, get the coloring, get the moving your body. As you know, when you move your body, it helps to release energy and balance out the energy. So maybe you might want to release, through music therapy. Maybe you might want to sing, who knows? Maybe you might want to create some short storytelling, or whatever the case may be. The freedom is yours to go out and seek whatever form of creative expressive arts therapy that you may be interested in. So once again, I hope that this video may have inspired someone, may have helped you learn, educate yourself on anything you may not have known about this particular topic. And as I said, this is my final project. And so that's pretty much it. Once again, I want to thank all of you for watching. And I'll be posting one more video after this, which is just a thank you video to my professor, Dr. Ty, and my lovely classmates. I've learned so much and I've gained so much from just sharing and talking about the variety of topics I've discussed on behavioral health and mental health. I've truly been out my comfort zone. I'm not one to really like talking on camera. So this whole, for me, this whole experience in pursuing behavioral health has truly pushed me. I believe it has pushed me into more in alignment with what I believe I was meant to do and meant to be. So again, thank you all for watching. Have a great day.